Dr. Yael, she is a principal clinical psychologist at Tara Hospital. And what is great speaking to her is that she will be able to give us practical examples of how to recognize depression, also what to do with depression if it is in our homes. Dr. Yael is trained in both psychoanalytics as well as clinical psychology. She's almost 20 years experience with adults, adolescents, and as well as children. And hopefully we can talk through eating disorders tonight as well. So a warm welcome if you have joined our webinar on this special Thursday. We always think that nothing is coincidence, especially if we can get together like this. Thank you to everyone that is logging on. My name is Ilana, and next to me is Dr. Yael Kadish, a psychoanalyst and a clinical psychologist. Doctor, welcome to tonight.
Thanks very much, Ilana. I'm really happy to be here.
The topic they gave us is recognizing depression and anxiety in the home. And immediately those words are suffocating me because in lockdown, people became used to talking about their feelings. For the first time, you understand when someone is referring to mental health, they're not meaning that you are crazy or that you are different or that you're mashugana. We're actually referring to our heads and how our heads are functioning, especially during this time. Have you found that we are speaking up a little bit more about our feelings and our mental health now that we are in lockdown?
Yes, I think that is true, Ilana. And research from America shows that there's been 1,000% increase in people calling in on helplines with psychological issues to discuss. I think that it won't be any different here. People are becoming more and more aware of emotional issues, and something about Corona has brought to the fore the necessity for us to be able to talk about how we're feeling, because we're all really struggling emotionally with the pandemic.
In one of our other talks that we've had here on a Thursday, we talked about lepidology, and our expert pointed out how everything has been taken away from us because of this virus. We're not able to touch people. We're not able to hug our family. And it feels like we are stripped down to almost soul search and find out what we are really feeling. In psychology, this lockdown that we've been going through, what has it really done to us?
So I think there are a whole lot of things that it's done to us. One of the things is that it's taken away a sense of certainty that we have, and the fact that that is an illusion, because nothing in life is certain. However, now that we have this pandemic and it's the novel coronavirus, which means we don't know much about it, we're still trying to discover what we can about it. It's suddenly made the whole world feel uncertain, and things that we used to take for granted have fallen away. So a sense of the future, a sense of being able to plan things, a sense of being able to take one's health more or less for granted, you know, if one's lucky enough not to have an illness. But then also things like being able to see family, friends, to socialize, to plan our lives, all of that has been snatched away. So it's a time of tremendous uncertainty, and a lot of our comforts are not there anymore. And it really means, as you said, we kind of strip down to the bones of life, survival. A lot of people are struggling financially. No one knows what's going to happen. So it's really an unprecedented time that we're living through.
It is an interesting time, and every Thursday we almost unpacked why it can be significant and how we can grow better or even learn a skill during this time. If you just joined in, thank you so much. We are recognizing depression and anxiety in our homes, and we're chatting to Dr. Yael Kadish. She is a psychoanalyst and a clinical psychologist. Now, eating disorders is the other thing that you work with, or the other disorder that you work with, and I want to talk through that. But before I get there, so we're feeling this feeling of sadness. We are mindful that things are different. We are in lockdown. Things are, our businesses are failing, or it's not. We're thriving in terms of certain skills of juggling, but we are failing in terms of keeping to times, being a mum, cooking, running a business, and trying to run a household and looking after self all at the same time. So essentially, it is chaos. How do you recognize that you are depressed or that you're not just going through sadness? And I almost want to ask the question, so let's say you establish that it is a depression or a sadness or a deep sadness or a sense of loss. So what?
So, I mean, you raise a lot of very important issues. I think that it's actually normal, or maybe I think when we chatted earlier, you said something about average or maybe expectable, that people are feeling down and people are feeling anxious during this time. In fact, it would be quite strange if we weren't feeling that. And I think that's an important thing to take into account. So when we're talking about mental health and ill health, and, do I have depression? Is this something I must, act on? It's a whole different ballgame we're really talking about. So because of all the things that have changed, it makes sense that people are feeling down. There's not a sense of certainty as before, and we've lost a whole lot of our comforts, as I said. So that's kind of expectable. But when we're looking at, when must people be worried? It depends on the level or how serious, how intense depression or anxiety is. Now, remember, anxiety is a future-oriented space. It's thinking about the future and being worried. Will I do well in my exams? Am I going to get the job I want? Are people going to judge me favorably or not? All that sort of thing. It's about thinking about the future. And the future, of course, has changed in a certain way. So, as I said, anxiety and depression, we expect that. But if you feel that you or someone that you love seems to be really not managing, they're not functioning occupationally, at work, in the home, at school, and or socially as well, that there's really a big decline in that. And what do we mean by that? So there's a sense of a losing interest in things that you used to be interested in. Now, again, it's Corona, we've got less to be interested in. There's less that we can do. So what does that actually mean? So it's harder to judge that. But when there's, a sense that the person maybe doesn't want to get out of bed in the morning, you're feeling like you've got no energy, feeling helpless and hopeless, maybe a sense of guilt or a sense that you're worthless, those sorts of things really need to be taken seriously. And when we're talking depression now and diagnosable depression, and we'll talk about diagnosis, people also with diagnoses, when someone, a healthcare professional, assesses whether you're depressed or not, they'll ask you, have your sleep patterns changed? Are you sleeping more or less? And are you eating more or less? And that would be more a loss of appetite, or you just eating a lot. It's not that you're hungry, but you're just eating and gaining weight. Those sorts of things. We're looking at levels of energy. Is someone very agitated, or is someone just dragging themselves around and feeling awful? Now, the time period is also important. So if that's going on for more than 2 weeks, that you're feeling almost every day a sense of no hope, no energy, and all these changes, as I said, to your bodily rhythms and behaviors, that really is something to take seriously. And that would be an important reason to go and see a mental health care professional, whether a psychiatrist or your GP, a psychologist, to really see whether you need help. So, a diagnosis would be when someone listens to everything you're experiencing, asks you a whole lot of questions, and then might say to you, yes, I think you're depressed. That then means that you're going to be put in touch with help. That could be medication, therapy, a combination of both. But the idea of diagnosis is also can be quite a fraught area, because people often don't want to go and check out whether or not they are depressed or anxious, for example, because there's a stigma around mental illness or lack of mental well-being. And that's a real problem, because to be in denial or to avoid when you're really suffering or someone in the family is, can really lead to really tragic circumstances at the extreme. So it's very important to be mindful to pick these things up in ourselves, self-monitor, be self-reflective, and in others. Because the earlier we ask for help and we recognize that we're struggling, the more we're able to avert really serious consequences down the line. So that's very important.
If you just tuned in, thank you so much for joining us on this Thursday. Again, a very special day as we're recognizing depression and anxiety in the house, our live Zoom webinar. My name is Alana, and we're chatting to Dr. Yael Kadish. We're chatting to her about psychology, about recognizing. You touched on something that I'm so passionate about. I want to talk about diagnosis, and we're going to talk about eating disorders as well. She's a psychoanalyst as well as a clinical psychologist. Eating disorders. When do you know that you have one? I'll never forget, I was a student, and I remember that there was a young woman who was extremely tiny. And because we weren't educated as first years at university, we all thought, well, how do we become friends with this young girl? And we actually just tried to avoid her because we didn't know how to approach someone with an eating disorder. And I want to almost ask, first of all, how do you know you have one? And if you do have one, how do you get help?
So this is more and more quite difficult, in the sense that more and more society and our culture is pushing people, especially women, but also men now, to be thinner, toned, you know, with this kind of, everyone's on different social media platforms. Everyone has to look like they're having a more and more fabulous life. It puts even more pressure than before on all of us. And so it's kind of the norm to be even more aware now of appearance, weight, body size, eating, and it's become interwoven with well-being, their judgments around it. You know, are you a kind of a switched on sort of a person, or, you know, it really is more and more difficult to draw the line between eating disorders and preoccupations that are now more culturally normative, as I say. And the other thing is that people with diagnosable eating disorders are really quite bad at recognizing them in themselves. So normally people around you start to get worried first, and people with eating disorders will often deny and deny and deny, and actually not really believe that they have an eating disorder. But what's very important when we're talking about a diagnosis or a clinical eating disorder, so when we talk about a clinical eating disorder, there's certain criteria that need to be met. So, for example, you know, being sort of 10 or 15% under what is expected for your bodily size, your weight, your frame, for your height, being very preoccupied with gaining weight, restricting food more and more. So we're talking now the more anorexia side of things. And cutting down on social activities, being very, very avoidant of situations where the person has to eat, maybe telling people that they've eaten already when someone says, come for supper, come for lunch. No, I've already eaten. So there's signs where, you know, people start noticing that the person's withdrawing more and acting quite strangely or different to the way that they used to behave. And so the clinical eating disorders are still quite rare, meaning a true anorexia or a bulimia, but they are, you know, they're on the increase. So it's probably something around 5% of the population that have these disorders. But there are a lot more people that fit the subclinical eating disorder profile, which might be someone who restricts a lot, but isn't quite that skinny, that underweight, that their body stops functioning. But it's still a preoccupation, and it's still something that's taking away from their quality of life. The same with bulimia. And what's very difficult with bulimia is that most bulimics are of a normal weight or maybe a little bit overweight. So people don't pick it up. And people with bulimia are often so ashamed about being bulimic that they don't tell anyone. You know, it's called the woman's secret disorder. That's when it was first discovered, really, and named in the 80s. So it's really prevalent, and there's so much misery caused by this focus, this perfectionistic focus just on appearance. And yeah, it just leads to so much of a lessened quality of life, and to really life-threatening consequences in many circumstances.
Well, being in media, there's a lot of preach around what social media can do. And most of the time, it does a lot of harm instead of good. It's a world that's make-believe that doesn't really exist. And who cares about your friend's car if she bought another one and posted about it? The pressures of society on us, it seems like it's extreme. And now with lockdown, it's another thing that has happened that is so extreme. I want to talk about diagnosis. In simple terms, they would say you need to get diagnosed. My question is, and it's a very simple question. It basically asks, why should we be diagnosed? Other than the fact that it might, God forbid, be fatal, why do we need a diagnosis?
So this is a very important question, and it goes again around stigma and around the way that people generally tend to think about mental health and wellness. So, you know, the truth is that there isn't the sort of thing of black and white, that you're either completely mentally healthy or completely mentally ill. And that can be put across, and that can be a thing that people believe, but it's really untrue. In fact, we're all on spectrums of everything. Mm. So if we think about mood, if we think about levels of anxiety, preoccupation with eating and shape, all those sorts of things, actually, we all experience different mood states, times when we're more anxious, less anxious, times when we've had losses, we are bereaved, and all of those states are a part of, you know, the geography of mental health. And it's important for us to know that and say that, so that we don't get caught up in this thing of avoiding getting help, because we think if we get help, oh, that must mean I'm crazy, I'm losing my mind, you know, some kind of an unwell person. So that gets all caught up with the idea of diagnosis. You know, I mustn't come forward and get help. I mustn't go for therapy because then I'll be diagnosed. And in fact, what diagnosis is really for is if someone is really struggling and they need to access help, for example, from a psychiatrist who will prescribe medication. The psychiatrist needs to sit and talk to you and needs to see how you're dealing with your life, how what you're feeling is getting in the way of the way you live your life, and where that is on the spectrum that I'm talking about. So a diagnosis will be made, and then you'll be prescribed medication. Psychologists don't diagnose in the same way, but now with, you know, medical aids, etc., psychologists are kind of forced to make diagnoses. So it's become something that psychologists do more and more. But again, this is about what you're struggling with. Can we have a clearer picture of the struggle? But that mustn't be confused with, say, a diagnosis of chickenpox or of COVID, where it's much simpler. It's yes or it's no. So mental health is not like that. And you know, psychiatry, for example, goes in the medical model. All psychiatrists are obviously doctors first. But if you really ask psychiatrists about, you know, is this person depressed? Do they have a mood disorder? Do they have a personality disorder? It's all about observation, asking questions, you know, seeing, well, there's quite a lot of this or that, and then making a diagnosis. There is no blood test. There is no, as I say, it's not black and white. So that's really important, that it's not something that if you meet a diagnosis now, this is now a label that you carry around with you forever. Of course, there are genetic components, but even with the illnesses that seem to have most evidence for genetics, for example, bipolar disorder and schizophrenia, studies that they've done, identical twin studies, the best kind of studies, because there have been situations where identical twins have been raised apart, been adopted into completely different families. And what we see then, because now we've completely controlled for environment. We have two totally different environments and the same genetics. There is a maximum of a 50% of both twins having, schizophrenia or bipolar disorder. Right. So even in something that is genetic, environment plays an enormous role. So it's just important to keep that in mind, that it's always a mixture and a mixed picture.
I see that there's a few of us that have joined in. Good evening and welcome to our live Zoom webinar. We're talking about recognizing depression and anxiety in the home. Tonight we're chatting to Dr. Yael Kadish. She is a psychoanalyst and a clinical psychologist, and we're talking about diagnosis and the stigma around diagnosis. And we're saying, you know what, it's better knowing than not knowing. It's better knowing than seeing the consequences and seeing that something, God forbid, something bad happens. Doctor, I have to ask, diagnosis, does it go hand in hand with medication and therapy?
Yes and no. So I think one of the, I suppose, mistaken beliefs that are still around these days, even though psychology has been around for more than 100 years, is the idea that if you go and talk to someone about things that you're carrying with you, this means you're diagnosable, there's something really wrong with you, etc. Where actually more and more people go to see a psychologist or a counselor for personal growth. And I really believe that all of us need to speak to someone certainly at some stages of our lives. And it really is important because the earlier we talk and share and work through issues, the better for us. So for example, taking your child who might be very anxious, might have separation anxiety, or might just be a very anxious little kiddie, to take that child for some play therapy, if that's what a psychologist recommends, will have a real protective effect going forward when that child hits adolescence and all of that turmoil that comes along. So there's a really important protective benefit for therapy. But, I've seen patients in their 60s, 70s, even older than that. So there's no time limit on therapy. But when we're talking about medication, yes, so that needs a diagnosis. There needs to be a diagnosis, and then the doctor will find a medication that works for you. Now, again, with psychiatry, most of our psychiatric medicine today was discovered by mistake. Having these beneficial side effects, these drugs were developed for some other disorder. And then because of the side effects were then kind of adapted and used for psychological and psychiatric issues. But medication is something that you have to be very careful about, but it can be life-saving for people. And it can, when people are really severely depressed and suicidal, for them to be put on medication that allows them then to take part in therapy is a really important thing. So they really do work hand in hand. Medication is not curative, but medication really can help with symptoms. But it can take a while. It can take a while for, you need to work patiently with your psychiatrist. We'll try a different medication with you. Things don't always work immediately, certainly not. And also one can need to try all sorts of different medication until you get something that works. So it's difficult. It's trial and error. But worth waiting and going to someone who you trust and you can work with.
And this is development, right? So you're doing it because you want to be better and you want to be functional in society and in your home and a good mother and a good father. And that is why you go for a diagnosis and go through this. We had a question around eating disorders. It's one of the things that we spoke about earlier. Linda says, what about the other end of the spectrum, compulsive overeating? I would imagine that that is the same as not eating.
So yes, Ilana, it certainly is the flip side. So, and that's, I'm really grateful for that question because that's very important. And there's so much shame attached to that, to people who binge eat, who use food as a way of self-soothing. And there really are a whole lot of different reasons why people use food or the absence of food, starving, to try and manage internal states and internal emotions that don't feel manageable. And that needs to be taken very seriously and very sensitively. So it is a big problem. And there's so much judgment around if people are judged to be overweight. You know, it almost feels like it's getting worse and worse and worse. Susie Orbach wrote the book Fat is a Feminist Issue. I think that was the late 70s, early 80s. And it's even more so, and something about the particular pressure on women and being judged if you're a certain size, a certain shape. And we're even finding now in South Africa where eating disorders amongst Black women was not heard of. And unfortunately, from the 90s, more and more we're seeing, because of westernization, acculturation, and all sorts of things, Black women are showing as high an incidence in eating disorders, and both ends of the spectrum, you know, as white women. So there's unfortunately, these illnesses are around, and they're a way of trying to control what feels like unbearable emotional states. And those are not there because the person is lazy or doesn't try hard enough or anything like that. But unfortunately, people can take in that sort of really ignorant labeling. It's really a huge problem.
Doctor, there's so many questions I want to get through, and we still have a bit of time. We also have some questions. If you have some, you're welcome to comment, and I can ask Doctor some. I'm going to call these quick fire, Doctor, so we need to quickly get through them. And if anyone has more questions, then they are welcome to come and see you. Why not? Why do we want to blame people when we feel anxious or you realize that there's been a diagnosis? We want to say that it's your fault. It's your fault that I am like this.
So I'm not sure. I imagine the question is about if people are feeling anxious, maybe blaming family members or something like that.
Yes.
So when we were chatting earlier, I was saying to you that certainly mental health can't be seen as something belonging to the individual, and mental ill health. So we all belong to family systems. And even if we live alone, we are part of or were part of some kind of a family system. And very often, if someone is the person that's being labeled as the family problem, for example, they are carrying that for the rest of the family. Now, that is not the same as blame, although it can sound like that. And I think that's why a lot of people do worry about bringing their child with an issue or coming forward with some kind of an issue, that there's a blame by society. If your child's struggling, it means you're not a good mother, you're not a good father. If you're struggling, you're not a good wife, you're not holding it together, etc. And it's just simply not true. And it's so unhelpful that, but of course it's a prevalent belief, but it's just not true. I think, you know, we're all trying the very best that we can. And to think that someone would intentionally kind of be down or be anxious is ridiculous. Who would choose that? And so being part of a family system, a bigger community system, and all of the things that make us who we are, we will get, you know, some people get on better in their families or are a better fit. Parents will tell you, this child, it was easier to mother that child than that child, that sort of thing. That's just the way things are. We are born with different temperaments. But if you're feeling really anxious, if you're struggling with depression, etc., certainly through therapy, you're going to trace where that comes from. What is that about? But that really shouldn't be seen so much as blame, as a recognition. And then that allows you to start to work through those relationships and to try and take control over your life, not as sort of like get over yourself and take control, but really processing a whole lot of feelings, thoughts, etc., and parts of your history that maybe you've pushed to the back and haven't wanted to look at, especially trauma. You know, I think a lot of people go through trauma, early trauma, and trauma doesn't, we now think about trauma and PTSD, you mugged, you hijacked, God forbid, you raped, etc. But trauma can also be things that happen in the family. There are all sorts of trauma, and what trauma means is something absolutely overwhelming to that person's psyche, to their mind. And when children are very little, of course, they're not able to manage very much. They're very dependent on their caregivers. And so, for example, if a mother becomes depressed or ill, the father loses his job, lose parents, etc., parents aren't as available for their children, that's because they're mourning or they're struggling, they're anxious. But children struggle too because they pick up that their parents are going through something. They feel very frightened. They don't know how to make meaning of that. And so that can be something the child might carry, might blame themselves for, might think, it's because I'm a bad child, I'm not lovable enough, etc. So that's why it is so important when we're struggling and part of a family, and especially a young family, not to neglect when something is going on, because really it's extraordinary what a difference you can make in just being able to be helped to speak about these things in the family. Children then understand, okay, mom's very down or mom can't manage now. It's not you. It's extraordinarily helpful and protective to get help then, so that there aren't these sorts of things that happen in families and then there's blame. And so sorry, you said quick fire. That certainly wasn't quick fire.
But I'm enjoying your answer. I mean, you're so knowledgeable. And speaking of which, you had a big compliment from Megan. She says, very proud of an ex-Beta lady. Kola kavod, Yael. You've moved mountains, kind regards. And it's from Megan Cotson. So yes, we enjoy you very much. It seems like there's a sense of empathy when this happens to someone, or the person is feeling overwhelmed, or that they could be the problem child, the person that's experiencing all these emotions, that we should be empathetic towards them. What else can we do to normalize depression and anxiety and to make people feel less alienated? Why did lockdown have to happen so that we can normalize it and speak freely about what our minds are doing?
Well, I mean, that last part, Ilana, one doesn't want to look at anything with rose-tinted spectacles. It's just not helpful. But certainly lockdown has had some good effects in terms of we've had so much taken away from us, so much that we've taken for granted, our rights, our freedoms. And of course, these have been for reasons of protecting us, whether or not we agree with all the steps that are taken by various governments along the world. We just have to, when you live in a society, you've got to trust those that make the decisions, and who knows. But to be able to appreciate, one's thinking about things that we took for granted before and longing for being able to do the normal sorts of things that we did take for granted can bring you into a state of gratitude for what you've had and a yearning to get that back, valuing friendships, connectedness more. People are taking a lot of steps, having Zoom calls. A friend of mine is a granny. She even went to her grandkids' home and she was just in the garage and she spoke to them through the windshield and through, here, granny's still here, etc. We've really had to do things to be able to have what we had before, again, which makes us feel grateful. And when we feel grateful, there's a whole lot that we can do, because we're not at a place of wishing that things were different or wanting more, wanting to be different than what we are. In terms of empathy, like I said, we're all on spectrums of everything, So if we can't be empathic for others who are really struggling, it's going to mean that we're going to have a lack of empathy for ourselves and a harsh judgment of ourselves. And all of this perfectionistic stuff again, and the sort of you are or you aren't struggling, we're all struggling. So again, if someone is feeling depressed or really anxious, panicky, this is not something that someone would choose to do for no reason. And to be empathic, to reach out, to talk, to be an ear, and even just to say, I can see you struggling. I noticed this or that in a kind way can be very important, because people can feel afraid of admitting it, or they're hoping that it's going to go away, which, it may not. So much of what we struggle with is because we don't talk about it to other people, and people feel more and more isolated and have less and less energy to tell people and fear the judgment. So we can see it's this kind of loop that goes round.
So, Doctor, I have a radio program, and this week I opened a topic around alcohol being banned for now, the extension of. And I asked the question, I said, how many of you without alcohol will not go back to drinking it? And I had someone contact me who was anonymous, who said, if it wasn't for lockdown, I probably would not have known how to stop drinking, because he was an alcoholic for 35 years. And this was the first time that he knew himself sober. And he says lockdown helped him. And I can see how his curse became a blessing, because he can help other people and help them discover that there is a possibility to stop drinking if they need to or want to. How can we look at mental health as an example? And because when you hear the word depression or anxiety or diagnosis or even medication or therapy, usually there's no positivity connected to that. We're still in the stages of learning that it's to help us. How can mental health, mental illness, how can our curse become our blessing?
So I just want to pick up on what you said about the gentleman who was struggling and who stopped drinking because of lockdown, because you touched on a very important point, and that's of substance use and abuse. And one of the things that really we have socially is an abuse of alcohol and of drugs recreationally, rather than getting the help like psychiatric medication or a diagnosis. So a lot of people will use, for example, alcohol as a way to not feel. And we know disorders like post-traumatic stress disorder, depression, anxiety, people turn more and more to alcohol. And that, of course, then becomes its own whole disorder, and people lose so much through substance abuse. And yet it also is kind of normative. Teenagers drink, they binge drink, they abuse alcohol. Parents aren't sure, when is this really a problem? When is this just part of the phase my child is going through? And also what kids see in the home. You know, we're having another l'chaim now. It's all about, you know, so we have to also be honest with ourselves about our own alcohol use, about, you know, is this something that I could give up or isn't it? And the real test about whether you're addicted to something or not is, for example, with alcohol. Can you have one glass of wine or, you know, a gin and tonic or whatever socially, and can you stop there? If you can't stop, you do have a problem with alcohol. So, you know, that's different to the kind of stereotype that you have to be sort of fall down drunk or something or drink every day. But can you have it as part of your life? Do you have control over it? So the gentleman that you talk about, and I've had other patients and similar things that we're seeing in the hospital, where people are now having to stop and actually realizing how much they've lost through substance abuse and starting to make changes. So that can be a very positive effect. It's not the case for everyone. You know, someone who's relied on a substance for so long to manage their internal states, their feelings, it's not very easy when that's all stripped away from you.
Yep.
So that, you know, and that would really be something that a person should consult a therapist, should really expect to feel a whole lot of feelings coming at them, and to need time to process things themselves, again, without the substance, to get used to something that they haven't done for a very long time. But in terms of the mental health, yes, if COVID means that our mental health is now taken seriously and it's now a mainstream thing that we acknowledge, we are all struggling. How could we not be? And it's not only okay to ask for help, it's important. It's part of well-being. It's as important as all aspects of well-being, probably more so, because if your mental health isn't there, you're not going to feel like exercising, you're not going to feel like being present in your family, you're not going to have the strength and the energy to be fully part of your life. It's about quality of life. So if it can have that effect of destigmatizing mental health and mental illness, that would be excellent. And hopefully that would be a lasting consequence of this pandemic, which it seems to be. Early signs across the world are seeming to show that suddenly there's this recognition worldwide. We need to spend more money on mental health. That's very important.
Mm. Well, if we learned anything in lockdown, it could have been this: to normalize, to speak about our feelings, and also how our minds work, and to not judge those feelings. Dr. Yael, this has been insightful, and I can tell that a lot of people on the comment section, they're very proud of you. Carol, also thank you for your comment that says anxiety is real, it affects the whole family. Well, thank you so much for your contribution, recognizing depression and anxiety in the home. Dr. Yael Kadish, a psychoanalyst as well as a clinical psychologist. We really appreciate you participating this evening. Doctor, thank you. Thank you for your time.
Thanks so much, Ilana.
Thank you very much, Dr. Kadish, for the practical.
Are you back?
I'm back on again. Thank you very much, Dr. Kadish, for the practical tools and strategies you've shared with us tonight. In this anxiety-depressed full society, it is imperative to be equipped with the knowledge, tools, and insight to recognize the symptoms in ourselves and our loved ones and deal with them appropriately. You have really been most insightful. Thank you ever so much. Once again, thank you so much, Ilana, for your dedicated time as always. It's always truly appreciated. Thank you to all the listeners who joined us tonight. Have a good night.
Bye-bye, everybody.
Cheers. Bye.
Bye, Chaya.
Bye. Thank you, Ilana.